Campbell Newman is our guest. We've only got 3 or 4 more minutes. Robin at Wynnum, go right ahead.
Hi, Campbell.
Hi, Robin.
It's very exciting to be able to speak to you. Look, I was in the audience last night at the forum down at Wynnum for the Wynnum Hospital, and it was absolutely overwhelming with the amount of people that were there. They had said that to come along to the Metropolitan, the new South Metropolitan Board forum, and that they would listen to what we had to say.
Robin, we're time short. Can you just put a particular question to the
Thanks.
Premier?
Yes, thanks. We were expecting to be able to keep our casualty outpatient department down there at the hospital, and it was sort of fairly negative, the whole of the forum. People walked away very dissatisfied. So can you tell us what actually is going to happen to, it's being called emergency department now, but the casualty of the outpatients department at the hospital, please?
Premier.
Well, look, I'm going to be really quite emphatic about this. Everybody has said that Queensland Health is a large bureaucracy that is sort of unwieldy and with poor controls. Everybody in health policy across the nation's agreed that we should be looking at a better way to run the health system. And our government has set up 17 health boards, I said before. And contrary to what Des has said, I disagree. They are people from our community. They're from Metro South. There are other people from Metro North, and they are clinical people and business people. I'm just talking across the state from local communities, and they have been given the job of reforming our health system and doing a better job in each area. Now, I am not going to sort of come over the top, neither is the Health Minister, unless people are negligent or incompetent or financially irresponsible. There is a process of reform. What people need to do is make the case in the way they probably did last night to the local hospital health board, because this is about empowering ultimately people across the state. If centralisation worked, if the key to a great health system was for it to all be run out of George Street, then we'd be doing really, really well, and we're not. So what I'm saying is we put these people in charge only on the 1st of July. They've got a tough job to do to try and work out how to better run the health system, and they're going to go around and have a look at the various hospitals and facilities they've got, and that's what they're doing. So what's going to be the outcome? I don't know. It's their decision, though. It's not my decision. It's their decision, and unless they've done the wrong thing in the way I've said before, I'm going to back them 100%, and so is the Health Minister. So the best way for people who are listening, whether it be on this issue or in other parts of the state, this came up when I was in Gladstone the other day, some issues locally. The thing is to look up who is on the health board, the chairman and the members, and lobby them, make the case to them for why something should be done differently. Whether you want to change or whether you want to head off something they're doing, they are the people who are there to represent you and to best respond to the needs of the community.
We have a